here at Health Further, and today we've got a fellow from the Aspen Health Innovators Fellowship, who's an OG. I'm still going through the process, but he's an OG, and someone who's super respected in the world of healthcare innovation and health equity. Dr. Jay Bhatt. Jay, how are you, man?
Good to see you, man. It's wonderful to be here with you.
No, great to have you. Great to have you on the show. My partner Vic and I, we did a little bit of research on you, and there's a lovely video that Deloitte put out on your backstory that was, not too long and really helpful to kind of get a sense of how you got into health equity and into this space as a physician yourself, just sort of growing up in the household of a pharmacist in Chicago. Can you just share a little bit about that for the audience, just so we can set the foundation as we get ready to talk a lot about health equity?
Sure. Just thrilled to be here with you and Vic. And I'm the son of two South Asian immigrants. My dad, a pharmacist on the south side of Chicago. My mom, a factory worker. And so I spent a lot of time with Dad growing up in communities, in people's homes, seeing the day-to-day trade-offs that they were making between their health and their ability to have food, housing, caring for their kids. It really struck a chord with me about why are those choices being needed to be made when it comes to the health of an individual or family and then the health of a community. And so I really got interested in how we make that better and how we address the inequities that I saw as a kid, and then continued that journey when I was a college student in Hyde Park on the south side of Chicago, working with the community there. And so I've always been moved by this notion that health is something that everyone should have a fair shot at to achieve optimal health and well-being. And there are systems and structures and policies and just models that don't necessarily make that so easy to happen. And so it's been a big part of my journey to say that, health inequity is America's chronic condition, but we can actually address the Band-Aids that have been repeatedly put out and say, let's go upstream to reimagine a future of equitable health for everyone.
Yeah, excellent. Well, that's great context. Help me understand how you define health equity, or maybe for the listeners, how should we think about health equity from your frame of reference?
Deloitte, we define health equity as the fair and just opportunity for everyone to achieve their full potential, every aspect of their health and well-being, regardless of race, gender, ability, status, or zip code. This includes considering a person's holistic health needs and caring for the upstream drivers of health, or that some may say social determinants of health that have an enormous influence on health outcomes to the tune of 80%. And moreover, believe that health equity is a moral and business imperative. Health inequities that limit access to affordable, high-quality care cost the U.S. health system approximately $320 billion in annual spending. And if we do nothing different, in 2040, that'll triple to $1 trillion. It's $1,000 for every American today, $3,000 for every American in 2040. And so it adds up. You talk about a family. And I would say it's also broadening the aperture. So it's not just race and ethnicity, although disproportionately impacts this issue, but it's people in rural communities, it's veterans, it's people with disabilities, it's the LGBTQIA plus population, it's women, it's, can be looked at with a broader aperture when we think about this. It's you, and those that you love.
Yeah, that's two things I want to just circle back on. One, $1,000 for every man, woman, and child in the U.S. every year, and tripling is kind of an amazing stat. We could do a lot if we spent that $1,000 maybe more wisely in giving people the tools to advance their own health or make progress in their own health. Is that fair?
Yeah, I think that's fair in its part, but I also think there's systems and structures in the environment that makes it harder to have those individuals be able to achieve health and health span, which is longer life and better quality of life. And I would say the other thing that's important is that, particularly for the audience of Health Further, is there is opportunity and value creation opportunity when you lean into unmet need. And with this issue, there is significant unmet need, whether it be access points on virtual and digital, whether it be addressing triple negative breast cancer in women, or what we just saw recently, innovated around sickle cell disease and treatments there. So what we're also building the evidence around is that when you lean into unmet need and into health equity, you can create economic opportunity and value and better outcomes, and actually, save the country a lot of money. I mean, we're paying more and getting less as a nation when it comes to health.
Yeah, so that's a good segue into what I was going to ask your opinions on, which is there's a lot of innovators and entrepreneurs that listen in our audience. What do you think is one of the 2-3 best opportunities that need focus in 2024, where we are right now, that the opportunity is in place if someone would just grab it and try to make a difference?
So I would say one, our research suggests that there's a premium on getting closer to patients, consumers, and providing them with more personal service and meeting them where they are. So in our recent data through a consumer survey, 3 in 4 consumers with Medicaid or on the health insurance exchange would use virtual health for mental health visits, and that retail clinics, virtual health, and community health centers could bridge care delivery gaps for populations that have been historically underserved. So that's one area. The other area I would say is emerging technology. In terms of generative AI, we're seeing consumers wanting to use that for their health. Either it's to become more educated, to help them manage their own health, to access information. I think that is another important area. The other is, as consumers gain access to increasingly insightful data about their health, they're likely to feel more empowered to make decisions about their own care and exert more pressure on the system. So we're starting to see a little bit of where consumers are challenging the status quo. And our recent piece and point of view on this is consumers could become CEOs of their own health. And when we look at even issues like food as medicine, more than half of those surveyed say that they are willing to pay a premium for foods that contribute to their health and wellness. And so when you see that, there's like this reassembly that happens in the industry where the consumer or patient may be outside looking in, is now inside that set of stakeholders, and all the stakeholders are aligned around helping achieve the best health for everyone. And we also think that employers could take on a bigger role in keeping workers healthy. And our research over the summer indicated that the average lifespan of Americans could increase by 12 years, and their health span, which is the time living in good health, could increase by nearly 20 years. And we have the tools and the science to do it today.
So talk about how we could build a bridge for people to make this change. I mean, I think I certainly want to be more healthy. I'd like to live 12 years longer. But it's sometimes hard to know what to do or to get there's a lot of data out there, but I don't necessarily have the best information. And 3 of us are, well educated. We're on the higher income scale, and still it's complicated. How do you think about getting easy to navigate data sources or inside information to the right people at the right point so they can make those choices?
I would say that we're seeing some of that happen now, certainly through virtual care, remote monitoring, and digital health tools. And I think that will continue to grow. Part of what I think about that's important, that's a companion to that, is like a walking genius bar. You think about literacy and how people can access and make sense of the information that comes through in various ways. I mean, I'm a primary care physician on the south side of Chicago now in a community health center, and I have patients that are very interested in the information that comes through their portal, but need help in making sense of it, because when you see something that maybe isn't within range, it may not be of concern because it has to be correlated with clinical findings, but they don't, as individuals, may not understand that and can create a sense of challenge and anxiety. So then it's helping navigate through. So I would say one is the wearables, the digital health, the remote health, offers people some of that tools, but then paired with that is kind of co-pilots and community health workers and clinical teams that help them make sense of it to take the appropriate actions. The other is misinformation and disinformation, that's continuing to impact particular behaviors or decisions. And I think that that's important to address as well. And then how do you design intent? So equity-centered design, so that we're making the thing that's going to drive towards health the easier thing to do for individuals. So one of the things that we're doing, particularly in the employer space with the American Heart Association and the Society for Human Resource Management Foundation, is health equity in the workforce. We're trying to impact positive health outcomes for 10 million workers by 2025, and we'll have tools for employers to deploy, whether they're self-insured or fully insured, to do this. But part of this comes down to messaging and how we communicate as well, and say, navigating through a journey of saying, where do you start? What are the things that are going to be the most impactful? Cardiovascular, mental health, and addressing those to begin with.
Jay, you've said we a lot, and I think the we here is Deloitte. And one of the things that I just find to be really interesting is that somebody like you is working at an organization like Deloitte. And I think, for a lot of our listeners, they're trying to figure out like how to make an impact, and certainly being able to work at a platform like Deloitte, gives you the opportunity to make an impact. But can you talk a little bit about why this matters for Deloitte? Like, they didn't just hire you and put you in a corner. Like, there's been an entire Health Equity Institute that's been established. You're talking about some major partnerships. Like, in addition to the goodwill, there has to also be some partnerships, some client demand for this kind of work. And so just talk a little bit about that, because Deloitte is not sort of the first name I would have thought of to be at the forefront of thinking and research on this important topic. But it's great because I think it adds legitimacy to it.
Yeah, I would say that often the public may think of Deloitte as a accounting firm, but Deloitte is much broader than that. Deloitte is a firm that advises clients in the market about how to be successful in business that may be consumer oriented, that may be policy and government, public sector, that may be energy, that may be tech and technology or media, telecom. And we can go down the list of the very financial services. I would say that health equity is everybody's business. When we think about health, it has such convergence across consumer industries, technology industries, financial. Even if you think about the wealth gap, that has an impact on the health gap. And the reason why Deloitte has really invested in this over the last several years is, one, the inequities that were laid bare by COVID made it very clear that there are differences that need to be addressed, that are systemic, structural, and could be accelerated by the impact of those Fortune 100, Fortune 500 clients we serve, including the government public sector clients we serve. So, and then the other is that there's a role business has to play. And that's basically what we showed by employers catalyzing healthy aging, that this notion that when people thrive, businesses thrive is important, but also that we have a leadership role to play, particularly with the social unrest that we saw during the summer of 2020, the pandemic, and that this issue touches everyone in some fashion or way. And so we are really excited about that. And what we're seeing in the data, even our most recent health equity outlook, is that more than 80% of C-suite executives in life science and healthcare organizations see health equity being improved as a top 10 goal for 2024. And that 50% are seeing a doubling of investment in health equity. And so it's not an issue that's going away. And what I would say is, when it's not considered a side hustle, when it's not considered a side gig, when it is embedded into the strategy, finance, and operations to help meet the need of your organizations, to help extend your business, to address unmet need, there is opportunity for both citizenship in the community, but also impacting business. So we see this as also work that we do within our own house. We have a DE&I transparency report where we have metrics that we're tracking against and making very public about policies, representation, governance, within our own organization, as well as products and services that we may impact. So we're working with our consulting teams around embedding health equity perspectives into their work as they work with clients. And then there is the social impact work that we do. And that's in communities, and then the ecosystem you can catalyze to come together. For example, in San Francisco, San Francisco brought together public and private sector actors to address sustainability there. Or we came together in Philadelphia with public and private sector players to address maternal health because they together wanted to do that. So I also think that the convening opportunity and the ability to share and move and accelerate action at scale is just one of the important reasons that Deloitte's done this. And not just in the US. We've got a Health Equity Institute in Europe, in Africa, in India, in Latin America. So this is a global endeavor, and we work with our global health equity network with the World Economic Forum, which has got over 50 multinational companies that are engaged in that work that deliver services across the products and services across the globe, and 100 CEOs that have signed on to a Zero Health Gaps pledge. So there is real interest across industries and across the globe to try to take this issue on as part of core business, in addition to social impact.
And Jay, it strikes me that there's a chance this is very well aligned across many sort of degrees of focus. Like, I want to be more healthy and have a longer lifespan myself, but I also want my organization as a whole to have more healthy employees. I want to offer, health equitable choices to all kinds of communities. And then that also the places where you can get a better return on the investment of time or money or resources, you might get a better impact in places that really have a big need. Is that right? That you can sort of get this, I don't know how many of those, 3 or 4 things aligned together?
Yeah, you get a domino effect, and it's catalytic, and across these different domains. You say that people, clients, and society, but we've demonstrated and continue to build the evidence that if employers lean into this for their people, not only does it create this impact on healthy workforce that is more connected to your organization and to the work. There's also opportunity, for example, for our people to be involved in this work, creates a sense of connection around purpose and meaning. So we're not just only doing work that is impactful from a purpose orientation for clients, but also for society. And I think that's a powerful thing around the health, of individuals in your organization. And I would say that we're seeing just real excitement among people within our organization and others where they're leaning into this work. And for your audience, I would also say that the other thing that's interesting is the demographic shifts. We're seeing very real changes in people in this country and the backgrounds and the things that they're interested in, and then more science that emerges about what people need and could benefit from based on where they live, whether it's the environment or what they have their background to be. But we're seeing, for example, startups and innovators engage around services for Black women or Latinos with diabetes, DHEI plus, or women. We produced a piece that showed women pay $15.4 billion more out of pocket on healthcare expenses, employed women than men. And then maternity care isn't the thing that's driving that. It is really about design, intention, and so there I think a lot of angles for innovators and for investors to think about the value creation opportunity and the impact opportunity when you lean into health equity.
With Deloitte's global reach, can you observe opportunities that maybe you're seeing a real impact in another country that you could bring to the U.S., or things that are in a slice of the U.S. population or demographics that you could bring to a different one? Is there an opportunity in there?
Yeah, I think that is definitely this notion of global advantage, where we learn from interventions and actions happening globally. Now, for example, our Health Equity in the Workplace guide that we work on with the American Heart Association and SHRM Foundation is U.S., but also global in terms of the strategies in that guide of what can be done. So think about community health workers. They work very effectively in the developing world in terms of helping be accompaniment or partners, collaborators to individuals in their health journey. We're seeing some build of that here. We've got the evidence here, but because of workflow, care models, integration, it's harder. But that's an example of evidence-based, high impact opportunity. The other is around life sciences. Globally, we see a lot of interest in R&D and innovation around life sciences and biotech. That I think can be brought here. I would say an example is the pulse ox, which we saw in the pandemic, wouldn't register for Black communities the level of understanding around their oxygenation as it did with other populations. But I haven't seen yet that be addressed from a med tech standpoint. And there's an opportunity there to get to the next level of that device. So, and then when it comes to maternal health, cancer, mental health, those are global issues that I think we can all collectively work on and learn from each other. And then there's the work we did with Johnson & Johnson and Deloitte Digital called Illustrate Change. Less than 5% of people with darker skin tone, or let me repeat that. Less than 5% of medical images represent people with darker skin tone, which has an impact on diagnosis and treatment, but also people of color seeing themselves in science and in medicine. And so we're working to build a large digital library of these images that can be used by those in healthcare.
Yeah, I know you saw that live, but I just think that maybe it's seeing themselves, but also just engagement and understanding their own diagnosis. It's easier to engage and learn if you see someone that looks similar to you. It's more engaging, I think.
Yeah.
Yeah, well, I mean, I wanted to. You went there with the Illustrate Change initiative, and I wanted to talk about that because I did see it at Aspen Health. The whole installation that you all did there, and I was struck by just the beauty of the art. Right? I mean, it wasn't just a bunch of medical pictures. I mean, it was art, and I sort of walked away from it with a completely different view on the kind of work that we can do to communicate healthcare issues. I think we're very stuck in the healthcare space around how we communicate around these topics. It's either hyper technical, hyper policy oriented, very, very wonky, and it doesn't really speak to people in any way that's going to resonate, make them feel something deeply. And also, I would say, level the playing field where people who are experts, but people who are also laymen can all look at something and appreciate it and pull away pretty much the same thing from it. So I thought that the Illustrate Change initiative was groundbreaking in that way. Two questions about that. One, who came up with it? And then two, why did Deloitte and you and Johnson & Johnson decide this was something to actually do? I mean, I know that organizations sponsor this kind of stuff all the time, but this to me did feel, groundbreaking and felt like it could be a model for how we can change the way we're communicating, meaningful healthcare issues.
Yeah, Marcus, I think this point about communication is so important and how we demonstrate and illustrate technical issues in a way that they touch the heart. It's in a way that helps people understand them. I think this is really around a discussion with Deloitte Digital, and J&J is around the Race to Health Equity Initiative. Say, where is a gap? Where is there a gap that if we did something, it would have a meaningful impact at scale quickly? And so the data suggested that there just isn't these illustrations of people with darker skin tone, and we know that has an impact on diagnosis and outcomes. But also this point that was made about just how people see themselves in this and see themselves in science, and not only from a patient consumer perspective, but also as a professional. So there have been a number of illustrators. Chidebere, one of them, but there are a host of illustrators that are looking at this topic. And so one of the ideas is that we don't have enough of these illustrators. And so working with an organization, an association of medical illustrators, also supported scholarships to help build the training and capacity of illustrators to be able to contribute to that. So is that kind of a gap, workforce, and an opportunity to communicate and quite literally illustrate in a way that can be accessible by the public, but also by clinicians and by the industry.
Yeah, I agree. I mean, the Illustrate Change set of drawings that I saw online, they are beautiful, as Marcus said, but they also are really informative. I mean, there's a lot of educational content there that you don't have to look into, but if you choose to sort of dig into it, you not only do you see Black and brown folks in the illustrations, but then you also can learn a lot, and you sort of get this multi-level aspect of it, which was really, really powerful. I think so.
These things, that's the other point from this, is that health equity is in an integrated endeavor, and it's having different perspectives and points of view that are coming at a single mission to make health better for everyone, to think about these kind of innovative ideas. And so it takes a team, and it takes people with different perspectives and vantage points.
Yeah, we were looking at the 2024 U.S. healthcare outlook that Deloitte published. It looked a lot like sort of our year-end review and look forward into 2024. Durable labor issues, policy issues, AI and ML from a technology perspective. Kind of the general things that people think about. But I recently read an article that was talking about the challenge that we've sort of gotten ourselves into with language, right? Where it's very difficult because of the political environment to say something that is meaningful without it being, taken as being incendiary, right? And so I'm just sort of wondering, what is your view on how we can integrate this very important issue that has real economic implications for all of us, regardless of how you sort of process these words, a word like equity, right? How do we communicate that, and how do we infuse that against all of the backdrop of all these other issues that people would say are more important, right? Workforce issues or policy issues or the changes in Medicare Advantage. How does health equity as a overall initiative make its way through there and navigate, I think, the additional challenge it has of working through the word war, right?
Yeah, well, I think we need to continue to demonstrate and build the evidence that there is an economic and value case with health equity, and that's resonated well. The other is framing the language from just where you live and your genetic code and a number of other factors impact outcomes. And when we talk about this across broad populations, about the zip code and where people live has an impact on their health outcomes, that seems to resonate. And that this question of, are you going to say you don't want to have a healthier future for everyone, or the potential for that? Or even just this notion of like a living wage for your for family. Like, would your family want to have a living wage? So I think it's also to the point I made earlier about broadening the discussion. It's when we think about health equity, we often people may think about a segment or a particular set of population, but it actually, you zoom out, it has place-based implications. 60 million in rural communities that have challenges with access to care, or you have people with disabilities or veterans, or women, or you can go down the line of different circumstances and ways that it shows up. The other thing I'd say is when leaders start from the frame that it's something separate, we're already behind the eight ball, because of the issues you mentioned. Health equity is embedded in them. The notion of just better health for everyone, and that recognizing that some people, because of circumstances in the environment or economic gaps may just need more support than others to have that opportunity for health and well-being. And so I think that alone should inspire innovators and businesses to create products and services. And it's interesting, we're seeing a big discussion around fresh food as medicine and grocers becoming health organizations in some way, technology providers that like Instacart and others, across using various tools around health. So I just think we're going to continue to see this kind of convergence more and more. We did a piece not too long ago on accessible banking for people with disabilities, right? Think about people with disabilities may have challenge having banking, which has a material impact on their economic mobility and their health. That's a health equity issue.
No question.
Right?
Yeah, I mean, I
call
think
it health equity in that way.
The politics can be toxic, certainly, and we're in an election year, so I'm not going to dispute that. But I think there's an opportunity in health equity to kind of help people resonate with our common interests. Like, I'm scared of getting old and dying, even as a rich white guy in Nashville. And I think everyone has the understanding that I want to be healthy. I want my kids or my parents to have healthy lives. And that's true no matter what your background or socioeconomic situation or race. And if we can frame it in where we see the commonalities, and then I love the way I'm not going to get it right, but give everyone the opportunity to have the best health. That's something that I think everyone should opt into. Whether they do or not, I don't know, but I certainly do. And it can be more constructive than sort of like setting things on fire and yelling around, which I don't know, at least for me, I'm tired of.
Yeah.
Yeah. Navigation is the other thing that's so interesting. Like, I think even people that may have means and and economically advantage still have challenges with navigating through needs that they or their family members or loved ones may have.
Yeah, I don't care who you are. Marcus and I were talking about this a week ago off camera, but we both in the last 2 months have had to call friends of ours in health systems to figure out how to navigate the system or find a way to get our loved one in. And it's not necessarily money based. You happen to have someone's cell phone number, and that's not fair, and it shouldn't be that hard to navigate for anyone.
That's right. Jay, give us a note of hope, but maybe also motivation for us as investors and also for innovators. Just kind of a departing note. Look, some of the categories that you mentioned, we've already made investments in that space. Both Vic and myself, and at our pre-seed fund as well. So we understand the importance of this, but I would also say, quite frankly, sometimes some of these issues, no one's working on. You highlighted, the Pulse Ox dark skin issue, right? I mean, and no one's working on it, right? So there are opportunities.
I didn't know about that issue till right now. So that's how bad it is.
Yeah, and I could have told you that, but
yes, but,
it would be one of a million issues that I deal with that you don't. But anyway, just give us a little bit of inspiration around the things you're seeing out there and the real opportunities, and why it is important for investors and innovators to come together and partner to address some of these unaddressed issues.
Yeah, I would say I'm encouraged by what I'm seeing in terms of the kinds of innovators and investors coming into the space. In our work with social entrepreneurs, we're just seeing people of color and women and all sorts of individuals of backgrounds, traditional investors and new ones, to think about, hey, there is an opportunity where I can not only invest and contribute to driving growth, but I actually can impact society in a really meaningful way. And we've just seen it even in recent months, like some of the activity in the life sciences realm, and even in healthcare delivery. And I would say that the winds of regulatory support for this are just continuing to grow, to try to give, I think, innovators, investors tools to help. And we've, I think, done some of that in our work with making the economic case. And so I think that there are bright spots. There continues to seem to be energy and investment interest in the issue. And I think we need to continue supporting those exemplars for showing progress and help them scale, because that's going to be a snowball effect and make a big difference to kind of accelerate the impact in this area. And I just think, to Vic's point, there's a lot to learn about from the globe to bring to bear here, whether it's from an innovator investment standpoint or interventions and tools that can advance a healthy future for everyone.
Awesome. Well, man, thank you so much. I
want to talk about his book.
Oh, yeah.
So you have a book that recently came out, right? Let's talk about that for a minute and sell some copies.
Yeah.
Talk about your book. Yeah.
So this is a passion project. As we continue to think about opportunities to make healthcare better, quality and safety is an area that my colleague Dr. Agarwal and I work on, and we know that there's been a lot that's changed. COVID, the health equity issue, the opioid epidemic, how health systems engage in care delivery with the kinds of teams and the team-based interdisciplinary care approach. And so we thought we would bring the voice of experts and experience together to create a case-based playbook on continuing to move the ball forward on quality and safety, kind of patient safety next level, and embed some of these issues that we experience in healthcare delivery through that, including navigating the system, specialty care, care delivery in various parts of the health system. So gotten a good response. We're excited about these cases of experience being put to use, and ones that work continue to get scale. Yeah,
I love the case kind of design of it, because I find that I learn best by sort of watching and reading about a case as opposed to sort of more of a textbook-based thing.
Yeah, I think we found, to your point about communication, messages like being able to tell a story and say, here are the actions that teams took, leaders took to get to these outcomes, and illustrating that, I think, is a very meaningful way to go about learning.
All right. Thanks for the reminder there, Vic. We did need to cover the book. But Jay, we're going to let you go. Thank you so much, man. Keep up all the good work. We'll be tracking what you're doing over the course of the year, and hopefully you'll come back on the show and give us some good updates about what's going on in the field.
Thanks, Marcus and Vic. Appreciate your leadership, and just an honor to be part of your show. It's a fantastic work that you all do to lift these stories and perspectives up. So thank you.
Thank you, man. Thank you. All right. Have a good one. So we just got done talking to Jay Bhatt. What'd you think?
It was great. I mean, it was really impressive, and you said it during the interview, but Deloitte has a huge reach, and it's really wonderful to see them using it in this way. Yeah,
massive platform, and certainly they're known for their accounting prowess, but also as a major consultant to
huge
the biggest companies in the world,
right.
Biggest organizations in the world, not just companies, but biggest organizations in the world, governments, et cetera, et cetera. I was just struck by the breadth of information he was able to just spout off that I think was very relevant. Like he could be a regular appearance on our show, just in our regular conversations, just talking about the numbers, the dollar impact. What did he say? $460 billion today that could shoot up to over $1 trillion by 2040. Was that?
Yeah, I don't know.
Were those the numbers there?
I don't know, but it was a lot. I mean, it's in hundreds of billions of dollars and tripling in the next 20 years, 20 years.
Yeah, I think the mental note that I made when he was shooting off the numbers was it's more than 10% of the current total spend.
Yeah.
Could be shaved off, right? If you address this particular segment, from an investor perspective, it seems like you should be able to have a totally dedicated fund if the economic impact is actually 10% of the overall healthcare industry.
It's a huge market opportunity, but also I think it's it's under built out. So I think there's a lot of dollars at stake, but also there are not many innovative solutions that are in market right now. So definitely it could be an opportunity. And it'd be great to have him back on. I think there's a lot to talk about. We could have gone on much longer.
Yep.
And we could circle back every quarter, every couple quarters or whatever, and just see what they're doing. And, we might have different questions to ask them too. I think Medicaid, is related to this. It's not exactly the same.
Sure.
But it's a huge financial opportunity that I'm looking at investing in too. So it's all integrated together.
Well, from the U.S. market perspective, Medicaid most closely tracks to this issue, right? As you start talking about a lot of the financial, social determinants of health, the things that are not related to a particular diagnosis or code, but that definitely impact health equity. Medicaid is that's the market, right? That's the payer market for it. Speaking of Medicaid, one of the things that I liked that he did that I think will stick with me as a mental model is drawing a direct line from the global health issues from an investable market perspective in terms of where they actually can influence the United States. So pointing out life sciences, pointing out, certain things like maternal health, right? There are these things. We talk a lot about how the payer markets are different in the US than they are in Europe, than they are in Africa, et cetera, et cetera. So it's kind of hard to translate those things. And he pointed that out, but he did, I think, highlight those areas and those aspects. And that's something you get from a global organization like Deloitte. Those areas where you can draw a straight line between what's happening globally and actually bringing that innovation and that care model into the United States. So I thought that was helpful because I usually spend more time mentally on the negative side of that, just kind of thinking, here's all the reasons why it won't work. And I thought it was just kind of cool.
I think there's some parts globally where the U.S. is probably last, like public health. Public health, for instance, he talked about community health workers, which I think is a piece of public health.
Exactly.
Where community health workers in other countries are much more impactful. I think they're probably supported and invested in more, not just in dollars, but in people, time, resources, attention.
Well, they're also closer to the baseline, right? Because he was talking about community health workers in the third world being very, very, very impactful, third world. And as he said that, what I thought he was going to say is that's easily translatable to our lower income towns and cities here in the United States. He didn't say that. He said it's actually harder because the payer models here don't necessarily support it. And we've been talking about how in the latest round of healthcare policy updates that the White House has pushed through with CMS, that in the physician fee rule, they've, throttled down dollars to physicians and throttled up dollars to community health workers, to caretakers, right?
Yeah, they're trending in the right direction, but I think we're still way behind. And I don't want to put words in his mouth. I will say, I don't think the incentives are set up the same way, right? Like the developing world, they don't have as many high dollar diagnostic tools or really fancy kind of procedural tools, but their public health and their community health and just like the hands-on helping folks navigate the day-to-day life, I think we could learn a lot from that.
Yeah.
But we need to change some of the incentive structure. CMS is working towards that, but I think we have more to do. The other thing I was really surprised about, pleasantly surprised, is he seemed really interested in AI and trying to figure out where it should be used to educate people, to engage with people, to help them understand where they are today and how they could affect their health span.
Yep.
Which was pretty interesting.
Well, I think generally speaking, he was very technology forward in terms of areas that could create more health equity opportunities, right?
I think it's kind of impact. Like you can impact a lot of people.
Yeah. Well, I mean, yes. And also it just sort of struck me as one of those things that culturally, he didn't say it, we didn't talk about it, but as he was saying it, I was sort of thinking people generally seem to associate populations that are in a lower socioeconomic band with being less technology capable, like less technology aware, having less access to technology. And we know like cell phones are ubiquitous, right? I mean, that's the delivery mechanism and everyone's got one. Right. And I don't care if you're on Medicaid or not, like you've got a cell phone. So I did like hearing him sort of leaning in with those like, no, leveraging tech and leveraging the latest tech. And this actually goes back to the third world stuff. We've seen how in still developing countries where, because they don't have all the existing built out infrastructure that we have in the United States, they were able to just sort of go, leapfrog directly into cell phones, right?
They don't have to have all that sunk cost.
Right, exactly. Yeah. And I feel like it's the same thing with the community health workers, right? Because they don't have all these hospitals built up everywhere, right? With the lobbying and all that other kind of stuff. They're just going right back to, well, why don't we just, have the people in the community who know the community and already care about the community, serve the community in an official capacity. Like for us, that's a huge leap, because we have structured the health system as the epicenter of community care, not people actually living in the community that know people in the community. So I just thought that was an interesting.
That, and we have this employer-based health payer structure that worked for the U.S. for a long time, but puts this weird artificial wall up between the overall public that needs healthcare services and the employers. And I understand why we did that historically, but other countries that don't have that just have a huge advantage. They just can hire community workers that's a lot more effective.
Yep. All right. Well, look, great episode. We're going to put a link to Jay's book and also to the Health Equity Institute that Deloitte has, that he is the executive director on, in the show notes.
I want to show people the illustration thing.
Yep, too. Illustrate Change. We'll put a link to that as well. And just generally, great episode. So we'll have Jay back on.
Yeah. Thanks.
All right, man. Thanks. Bye.